Nothing breaks our hearts more than seeing little ones up late at night crying, tugging on their ears, and just wanting some relief from constant congestion and pain that's caused by ear infections. And once you've experienced one with your kid, even just a few times, you begin to worry like crazy that every single time they get the slightest little bit of congestion or a cold, you're just waiting in dread that it's going to build up to an ear infection again and again. And for many parents, that's exactly the case. Round after round of ear infections, followed by round after round of ER visits, and of course, round after round of antibiotics that come with it, plus all of the side effects as well. So by age 3, it's estimated that 80 to 90% of kids will experience at least one ear infection, which should then get us asking the real question, what's different about the 1 out of 10 kids who do not get ear infections? If you'd like to stop the cycle of chronic ear infections or prevent them altogether in the first place, then you've got to watch this video all the way through to the end. So, one of the most common stories that we hear in our office during new patient consults goes something like this. A teething toddler starts pulling at their ears and isn't sleeping well. Mom takes them to urgent care and gets an ear infection diagnosis, plus a round of antibiotics. Mom and baby go home, take the antibiotic, and life goes back to normal for a few months, until it all happens again, and then again. And at this point, a referral to an ENT doc is suggested, and one anesthesia nap later, those tubes are placed so that drainage can occur. And sometimes this works, but sometimes it doesn't. And in many of the kiddos that come to our office for help, it's the latter result for them. They had the tubes, sometimes even 2 placements, and they still get ear infections with every single cold. It is a vicious cycle once it's begun. And there's no denying that it takes a huge commitment to break through it. It's tough, right? So if this sounds eerily familiar, you are not alone. We've been able to help parents navigate this exact situation with drug-free, surgery-free options many, many times in the past. So there's actually many ways that you can help kids get through ear infections without having to resort to antibiotics every single time or to surgeries and all the side effects that come with those options. So the natural solutions and options that are out there, they not only help the child get through those challenges, but they make the body stronger as a result of it, which is the opposite of what antibiotics and tubes are doing to their little bodies. But first, let's talk about chronic ear infections, right? So chronic ear infections result from a recurring buildup of fluid, inflammation, swelling within the ear that blocks the eustachian tube, and that leads to pressure and pain within that middle ear canal. And this condition, you'll hear it called chronic otitis media. Really what that means is it happens many times. Otitis is the ear, media is the middle ear inflammation. So there's 3 primary causes of chronic ear infections that are all tied to something that we call subluxation. First, there's a poor plumbing and drainage issue, and that results from misalignment in the upper neck, especially at the C1 and 2 levels, and that causes extra tension, inflammation, and just limited movement of the nerves to the muscles that supply the inner ear. So when we look at that here, we've got this picture. You can see the C1 and C2 nerve roots. They innervate this muscle right here called the tensor veli palatini, and this muscle right here is responsible for causing the eustachian tube, or that ear canal, to pop open and to drain that fluid down. But when that nerve supply is restricted from misalignment, that process doesn't happen, and fluid is allowed to build up in that middle ear, and it just gets more and more inflamed and occasionally infected. So that is the problem that we're seeing with kids who are suffering with these ear infections over and over. The second cause of ear infections is an excessive sympathetic or fight or flight state within the body. This also creates a high inflammatory environment, and it produces extra mucus in there as a result as well. So we have double the trouble. And lastly, the world that we live in has a ton of toxins, sugar, processed dairy, and so forth. And then when we add that to the pot, it makes healing from these things longer and worse. What we know from these recurring stories is that traditional medical treatments and even other natural treatments, they're just not cutting it. So since antibiotics and fever reducers do not address that root cause with that nerve supply head on, and in fact, it makes the gut and immune system weaker over time, there's a major reason for recurrent or chronic ear infections that continues to come back again and again, and it's that subluxation. In the same way, many families, they have gone gluten-free, casein-free, added tons of supplements, essential oils, all of it, yet they still struggle. And it shows that those things may be helping some, yes, but they're not addressing the root cause of the subluxation entirely. So here's how neurologically focused chiropractic adjustments can help. Our adjustments are designed to provide 2 main things that help kids and patients get to the other side of ear infections without drugs and without surgery. So first, adjustments increase that drainage and plumbing ability by getting things moving and cleared out once again. Often it's nearly immediately. And then second, those adjustments help balance out the nervous system and help reduce that sympathetic fight or flight state, which reduces the inflammation and just overall takes stress and tension away from the body. So in our office, the path to natural solutions in overcoming chronic ear infections begins with what we call our neurological insight scans. And these scans directly measure the amount of stress, tension, inflammation, and subluxation that so often builds up in the upper neck of these kiddos that are struggling with chronic ear infections, stemming all the way back from birth, typically with interventions like forceps, vacuum, and C-section that create that physical tension, that twisting and the pulling to the upper neck and the middle ear areas, leading to all of this trouble in the first place. So to learn more about how chiropractic can help your child overcome these challenges and to get your child scheduled for their own neurological insight scans, hit the link below. Learn more today.